Assalamu alaikum viewers, this is Dr. Khawaja, Saajid. I'm one of the orthopedic surgeon. I do hip and knee replacements, arthroscopies, fractures and tumors. Today the public awareness program which we are going to do is about the hip pain in children. It's also one of the most common problem in our society. We did a couple of programs earlier as well about this topic, because children and old patients, they're the most neglected, although they shall not be, but actually they are the most neglected people. We always say, oh, a child maybe he was running and he had a fall, it must be a muscular pain, oh, let him sleep, let him play, will be okay. Or old person, oh yeah, he is old person, so maybe a muscular pain, he will be fine, just give him some painkillers. So somehow they are the neglected people. If we specifically talk about the children, and pain in hip is very, very important. It could be a problem for the rest of their life. Just because we ignore the problem for a few days or few months. In children, more younger they are, very fast and quickly their bone grows, just like every day. Just like bone breaks and it heals within, I would say, a week or so. While in adult age, it takes months. So, time is very important for children, specifically if they have any problem. Time is very important to take to the hospital. Within that time, they shall be diagnosed and treated to avoid for the problem in later age life. The important thing which our viewers, I mean this program which we are doing for the public awareness, the important thing people, what can they do for their children, if they notice that any child is limping, do not ignore it. Even though you think that he might have a fall, because most of the time there is no eyewitness for the child if he had a fall or somebody hit him or something. So most of the time there is no eyewitness. So if you notice that your child is limping, do not ignore it. Take him to hospital. It will be very simple thing just to examine and get an X-ray. That will make sure there is no problem. Or if there is any problem, then within the limited time, we can treat it. Most of the problems are treatable. And I would say that most of the problems, specifically if we speak about the bones, most of the bony problems in children, because of trauma, they do not need any operation. Because the most worry about the parents is that, oh, we do not want any operation, because of expenses as well. So I would say that most of the bony problems, because of injury, trauma in children, they do not need any operation. Simple plaster, usually most of the time it works. But the important take-home message is, do not ignore any child who is limping, because hip problem, I have seen in my clinical life that the hip problem in children, if you do not treat them an accurate time, limited time, then it stays for the rest of your life, and at the end you end up with the operation, and problems stay for the rest of your life. So do not ignore it. Any child who is limping, problem could be in the hip, could be knee, spine, foot, anywhere. So take him to the hospital and take him to the orthopedic surgeon, especially for the limping problem. Orthopedic surgeon, I mean, we have done a couple of programs earlier as well about the specialty, why you have to go to the specialist, why not to go to GP. There are certain problems you can go to the GP, but awareness is to, if there is certain problems you can see that this is a problem, like problem with the bone, you have to go to the orthopedic surgeon. Problem with the brain, you have to go to the neurologist or neurosurgeon. Problem with the heart, you have to go to the cardiologist. So take a specialist, because he can give you the best opinion about their specialty, because they are the expert one. So do not neglect your child. Take care of yourself and your family. On display is my contact number. If in case anybody want to discuss or want to get appointment, you are most welcome. Thank you.